Good morning, my name is Monica. Today I am going to explain the pathology of rheumatoid arthritis as an autoimmune disease. Rheumatoid arthritis is a chronic systemic autoimmune inflammatory disorder that primarily affects synovial joint. In this disease, the immune system loses tolerance to self-antigens and mistakenly attack the synovial membrane, leading to chronic inflammation, cartilage destruction, bone erosion, and joint deformity. To understand rheumatoid arthritis completely, we need to follow the physiological, pathological process step by step. Etiology and predisposing factors. The exact causes of rheumatoid arthritis is not fully understood, but it develops because of uninteraction between genetic susceptibility and environment trigger. Genetically, many patients carry HLA-DR4 and HLA-DR1 genes, which increase the risk of developing the disease. Environmental factors such as smoking, infection, hormonal changes, obesity, and stress can trigger an abnormal immune response in genetically suspended individuals. Initiation of autoimmune response. The pathological process begins when the antigen present cells such as the dendritic cells present self-antigen to CD4 plus T helper cells. Normally, the immune system recognizes this protein on a self and does not react against them. However, in rheumatoid arthritis, proteins undergo a modification called circulation when the amino acid arginine is converted into circuline. The immune system started recognizing this circulating protein as foreign substance. As a result, T helper cells become activated and initiate an autoimmune response. Activation of T cells and B cells. Activation T cells migrate into the synovial membrane and release immunotherapy cytokines. These cytokines stimulate B lymphocytes. The activated B cells produce autoantibodies, mainly rheumatoid factors. Rheumatoid factor is an antibody directed against the Fc portion of Lg. Lg antibodies anticyclic circulating peptide. This antibody attack circulated protein and highly specific for rheumatoid arthritis. The interaction between these antibodies and their target antigen forms immune complex. This immune complex deposits within the synovial tissue and activates the complement system, further enhancing inflammation. Cytokine mediated inflammation. One of the most important pathological events in rheumatoid arthritis is the release of inflammatory cytokines. The major cytokines involved are tumor necrosis factor alpha. TNF alpha is considered the master cytokine of rheumatoid arthritis. Increase vascular permeability, synovial inflammation, tissue destruction. Interleukin 1 stimulation cartilage degradation and bone responsive. Interleukin 6 contributed to systemic manifestations such as fever, fatigue, anemia. Interleukin 17 promoted chronic inflammation and osteoclast activation. Synovial hyperplasia and penis formation. Persistent inflammation causes proliferation of synovial cells. Normally, this synovial membrane becomes thickened due to inflammatory cell inflammatory fibroblast proliferation, increased blood vessel formation. This abnormal inflammatory tissue is called penis. Penis consists of fibroblast lymphocyte newly formed blood vessels. In releases enzymes such as matrix metalloprotein, collagen proteins, satellite distribution and bone erosion. As the penis expands, it invades deeper structure, inflammatory cytokines stimulation, osteoclasts differing through the Rank-Rankle pathway. Osteoclasts are specialized cells responsible for bone absorption. Excessive osteoclast activity causes loss of bone density, joint space narrowing. The combination of cartilage destruction and bone erosion progressively damages the joint articulation, joint deformity, and ankylosis as the disease progresses. Ligament become weakness, tendon may rupture, joint capsule become dangerous. This leads to characterize ulnar deviation, swan neck deformity, bilateral femoral. In severe chronic disease, fibrous tissue may eventually be replaced by bone, leading to ankylosing, which is permanent joint fusion and loss of movement. Systemic pathological effect, because rheumatoid arthritis is a systemic autoimmune disease. Inflammation is not restricted to joint. The inflammatory cytokines circulate throughout the body and affect multiple organs. First is cardiovascular system, associated arthritis, pericardiac, increased cardiovascular risk. Second is respiratory system, interstitial lung fibrosis, pleural inflammation. Third is hematological system, anemia or chronic disease. Fourth is respiratory system. Fourth is eyes, skeletal epidermis, dry eye syndrome. Five is skin, rheumatoid nodules. Okay, thank you.